The Philippines has reported over 4,000 new coronavirus cases. It now has the highest number of infections in Southeast Asia. That's more than 126,000. The government says the recent spike in cases is due to intensified testing. The surge also prompted authorities to reimpose a lockdown in and around the capital, Manila, earlier this week. Medical workers are warning of a collapse of the healthcare system and calling for more testing and tracing. Nearly 1.6 million people have been tested in the Philippines so far. For more analysis on this story, I'm now joined by Dr. Wessam Atif, an occupational and public health consultant based in Manila in the Philippines. Dr. Atif, welcome to the program. Can I begin by asking your insight into the reasons behind the surge in cases in the Philippines? Is it really due to more testing?
Well, thank you very much for having me this evening. It's quite tricky, and yes, you cannot just say we are going to count the cases. And personally, I don't represent the government in any way. I'm an independent consultant. And as a public health specialist, I'm telling you that I personally don't mind that much the surging number of cases because it is not the reliable indicator for me. What I'm looking at is more the number, maybe the number of fatalities or the positivity rate of tests, or better, the number of hospitalizations of COVID-19 patients who need hospitalization. The number of cases can be affected by several factors. For example, as you said a while ago, if we do more tests, then simply we're going to get more cases. It is very hard to count cases in the case of COVID-19 pandemic. It's not like Ebola or like SARS before. It's easy really to do a count and confirm how many cases do we have, or take this as a reliable indicator. So I don't have a problem with that. So the reasons, yes, could be backlogs also from reporting from the previous days. So sometimes the Department of Health itself changes the way that they are counting the cases and get backlogs from previous weeks. Hence, the number of announced cases in one day could be surging. So I'd rather look at different indicators, really. Again, fatalities, hospitalizations, or the positivity rate of tests.
There's been a drought in the Philippines this season. Is that having an impact on the coronavirus pandemic there?
Well, I think it's the coronavirus who might be having the doubling impact. Droughts may be experienced all over the world. They have drought also in Africa. They have in different places. But the problem is now it is being compounded. It's complex because, of course, the lockdown measures is affecting the whole food chain, the logistics, the supplies, and of course it is affecting the business of the farmers and long-term food supply in the Philippines and everywhere in the world. And if you add additional lockdown measures to this, then I'd expect maybe a negative impact in the long term.
Most countries have had to deal with this dilemma. Do we open up the economy again and risk more infections, or do we enforce lockdowns maybe a bit longer and avoid more infections? What is the scenario for the Philippines right now? Is there a better way, in your opinion, to balance economic recovery and pandemic control?
Okay, thank you very much. Well, I think the first thing that I want to say is that we need to put things in perspective, especially for countries, for example, a country like the Philippines. The Philippines has not only COVID-19, the Philippines has other problems to worry about. According to a WHO report, for example, that I have in front of me from the WHO Philippines, every day in 2019, 70 people die of tuberculosis. Last year, we had an epidemic of measles attacking children, and we had like maybe almost 600 fatalities, and we had like more than 40,000 cases of measles in the Philippines. We have dengue fever, we have other diseases, and I'm not sure why the reaction is being taken that extreme for COVID-19, especially in the Philippines. I don't see it that way. So the problem with the Philippines and other developing countries is limited resources. When you talk about opening up the economy, you have scarcity of resources, right? So we don't need really to choose. What we can do is increasing the capacity, or trying to increase the capacity of our healthcare system. The problem is worldwide, as you said. All the countries have been trying to bring the number of infections below the current or the existing healthcare system, which in developing countries is actually quite weak and would very easily collapse, as you said in your introduction. Now, with the billions of dollars, that, for example, in the Philippines, how many billions of dollars were spent on things like mass testing and contact tracing? I'm challenging myself and I'm arguing with everybody, what has been the result so far of doing mass testing and contact tracing?
Okay.
This is not Ebola again. You cannot just, identify all the cases and isolate them. In addition, everyone has been under lockdown for quite some time. What more isolation are you going to do? So
Right.
I think it's time to think in a different way. Try to redirect these resources, the huge billions of dollars. So if you say that I'm limited on ICU beds or ICU rooms and I have 500, why don't you build 500 more? If your frontliners are being exhausted, why don't you hire 10,000 nurses? Why don't you get 10,000 more doctors, even from abroad, as long as you have the resources, instead of doing mass testing and contact tracing and giving people money just for them to stay at home.
Dr. Wessam Atif, I'm afraid I'm going to have to leave you there. We're running out of time. Thank you so much for making time for us today. Appreciate your insight.